Thank you, and I will be presenting our study on the effect of the small molecule tract agonist LM22B10 on functional recovery following spinal cord injury. I have no conflicts of interest to disclose. Damage of neural connections to the lower urinary tract have severe consequences to both bladder storage and voiding functions. Depending upon the severity of the disruption, it can include bladder overactivity, detrusor-sphincter-dyssynergia, incontinence, and chronic urinary tract infections due to retention and catheterization. The combined effect of these disruptions are highly debilitating and increase morbidity. Neurotrophic factors such as nerve growth factor and brain-derived neurotrophic factor have been shown to have a key role in the development of neurogenic bladder dysfunction. Accordingly, modulation of these pathways has been considered a potential treatment for various neurogenic dysfunctions. From a series of small molecule drugs that selectively target neurotrophin receptors, LM22B10 was identified and has been demonstrated to promote growth of hippocampal neurons. Therefore, our aim was to investigate the effect of LM22B10 on contusion, spinal cord injury, and lower urinary tract dysfunction in a mouse model. In this study, we used female adults, black 6 mice, and performed spinal cord contusion injury at T8, T10 spinal cord levels. Sham animals were subjected to a laminectomy without contusion. We inflicted a 75 kilodyne impact force, which is considered a severe injury. At the time of surgery, we also implanted subcutaneous osmotic pumps with either LM22B10 or vehicle to deliver the drug over a 4-week period. Mice were assessed for hind limb locomotion recovery up to 42 days post-injury, at which point they were used for cystometry or collection of tissue samples. Hind limb recovery was based on the Basso mouse locomotion scoring technique. Following contusion injury, mice were paraplegic and showed gradual recovery of hind limb movement. Vehicle-treated mice showed less of a recovery compared to the 22B10 treated mice over the 42-day period. We also examined the degree of weight loss following surgery as another parameter of recovery. Sham mice showed a gradual increase in body weight over time, and all spinal cord injured mice exhibited weight loss, with the LM22B10 cohort having less weight loss compared to the vehicle-treated mice. Here are representative decerebrate filling cystometries with external urethral sphincter EMG recordings from a sham, a spinal cord contused, and a spinal cord contused mouse with LM22B10 treatment. The sham mouse shows a normal systometric profile with long intercontractile interval and low filling pressure, and a sharp rise in pressure during micturition, and a decrease in the EUS tonic activity during the bladder contraction to allow urine to be expelled. In spinal cord injured animals, with vehicle treatment, there was a higher baseline pressure, frequent non-voiding contractions, and increased EUS activity in response to bladder contractions, indicative of detrusor-sphincter-dyssynergia. The LM22B10 treated mice has less frequent non-voiding contractions and DSD, suggesting better bladder emptying compared to the vehicle controls. The systometric data was correlated with bladder weights and histological staining, indicating that there was less bladder hypertrophy in the LM22B10 cohort and less collagen deposition in the bladder wall and mast cell infiltration. And lastly, we examined the effect of LM22B10 on the spinal cord lesion. The contusion injury results in the disruption of the spinal cord architecture, forming a large scar region that encapsulates the necrotic core and secondary cysts. The estimation of the lesion area by immunofluorescence showed that the average lesion area was greater in the vehicle-treated animals compared to the LM22B10 cohort. Additionally, there was greater collagen deposition within the scar region in vehicles versus the LM22B10 mice. These findings suggest that the LM22B10 treated mice may have a greater potential for neuroregeneration around the injury site. In summary, severe contusion injury in mice has a long-term detrimental effect on both locomotion and lower urinary tract function. Mice treated with a TrkB receptor agonist showed overall better recovery of the hind limb movement and bladder function. The LM22B10 treatment appears to reduce the spinal cord lesion and scarring, which in theory should improve the possibility of neuroregeneration. Thank you for your attention.